If you've ever found yourself Googling things like best shower chair, how to stop falling, how to help my spouse stay independent, and ended up a little bit more overwhelmed than when you started, then this video is for you. Because most people don't need more information, they need the right information, the right guidance. Hi, I'm Dr. Brandy Archie, an occupational therapist and founder of AskSAMIE. I work with older adults and people with disabilities every day who are trying to maintain independence, safety, and dignity, often without clear answers for support. So today I want to explain what occupational therapy actually helps with, why Googling tools or setting random goals is often not helpful, and how AskSAMIE makes it easier to get OT-informed guidance without scheduling an appointment. Occupational therapy is often misunderstood. We have a 100-year-old marketing problem. OTs don't just help people recover after an injury, we help people live their daily lives safely and meaningfully. So as an OT, I can help with things like moving around the house safely, getting in and out of bed or chairs, bathing and toileting safely, dressing with less pain and fatigue, getting back to work, getting back to doing school, managing our energy routines. The list is so long. We deal with vision and hearing changes, adapting the home environment, and supporting caregivers. OT is about how your body, your environment, and your routines all work together. And that's why OT guidance is so valuable, because problems are rarely existing in isolation. They're interconnected, and we look at the whole picture. Now, here's where many people get stuck. They know something feels harder, so they Google for maybe a tool that comes to mind or you've seen before, but Googling gives you thousands of options, not actually answers. So you end up asking yourself, which one is safe? Which one fits my body? Which one will fit in my house? Do I even need this? Problem is that tools don't work unless they match the person, the task, and the environment. A shower chair that's too low, a walker that is not adjusted properly, a bed rail that doesn't fit securely, these mismatches cause frustration and they sometimes even increase the risk. Yes, you might have gotten the right tool in name, but if it doesn't have the specific settings, features, or size for your situation, it's still wrong and unhelpful. Another common approach is setting really big goals, like I need to move more, I need to be stronger, I want to be more independent. But without the right supports and definition, that goal can just add pressure and not progress. So, from an OT perspective, I really appreciate you having general goals. But for us to help make it a reality, it needs to fit into your life by reducing friction in daily routines. When everyday tasks drain too much energy, people move less, they go out less. When you have a goal and it's undefined and not attached to everyday life, it doesn't actually get done. So it stays ethereal and unactionable. That can be misinterpreted as a motivation problem, but actually, it's a problem with implementation. We want to reduce the friction that keeps you from automatically doing it now so that we can make it an automatic part of your daily life so it happens all the time. For older adults, the stress often sounds like, I don't want to be a burden. I've always been able to do this. I'm fine, I just need to try harder. For caregivers, it sounds like, I don't know what to do next. I'm afraid of making the wrong choice. I don't have time to research all of this. Both sides are exhausted, emotionally and mentally, and neither one should have to be navigating this stuff alone. This is exactly why we built AskSAMIE, all of these reasons. AskSAMIE isn't a generic chatbot, it's a tool built using highly specific occupational therapy knowledge designed specifically to help people figure out what they need in order to fit their situation, tools and resources. So instead of just guessing, you can ask Sammy. At AskSAMIE.com, you type what you're struggling with into the box that says ask a question here. You can ask things like, I'm getting dizzy when I stand up. Showering is exhausting. My spouse is avoiding the stairs. What can I do? Getting dressed is hurting me. Memory is not as good as it used to be. And then Sammy will help you understand what's happening, explain why certain tasks feel harder, recommend OT-approved tools and services, and guide you towards safer, more supportive options. This is education and guidance, so you have the information you need to make the best decision possible. When people get the right support early, confidence improves and movement increases and health outcomes improve. And when caregivers get guidance, decision fatigue drops, fear decreases, and more goals actually get met. Getting support and guidance isn't a failure of your independence. It's a leverage point to get you where you really want to be. If there's one thing I would like you to remember, it is this. You don't need to figure this out by Googling or looking on Amazon, guessing and pushing through. Occupational therapy exists to help people's daily life work better. It's literally why we're here. And AskSAMIE makes that guidance a lot more accessible right when you need it. So if you're trying to maintain independence or support someone you love, you can go to AskSAMIE.com and just ask SAMIE, because support should reduce your stress and not add to it.